careful of that word. When you use that word in the presence of an orthopedist or a spine surgeon, they're going to think, oh, they have to go in and stabilize it surgically. We're talking about an increased neutral zone, an increased zone of laxity beyond physiologic limits. So it's hypermobility, clinical instability, let's laugh. Good. So I'm going to do a PA spring. I'm going to get on, so we'll talk more about this as we go through, but iliac crest in most people brings you to the 4-5 interspinous space. Why is that a good landmark for physicians? What do they use that space for? They find the iliac crest. They actually have a name for that called Tufier's line, I think it's called. The iliac crest right to the interspinous, the space between the spinous process of L4 and L5. What do they use that for? Spinal tap. That's where they go in, right there, between 4 and 5. And the posterior dura has no pain sensation, so it doesn't hurt. So go right into the subarachnoid space and take out the spinal fluid. So we find that space. I'm on 5. I use the hypothenar eminence, and I'm going to ask him, this is the person with pain, come in to have some back pain. I'll ask him, tell me if this worsens it or induces it. And I do a little PA right here. 1, 2, right on 5. I go to 4. And I do it again. PA spring. Any pain? I go to 3. I go up to 2 and to 1. So 5. You could even do it on the sacrum. I think it's worthwhile because you'll pick it up at 5-1. So if you go down, you find L5 below that intercrestal line, and then go down just one more to the first bone of the sacrum, the median sacral crest of S1. Push on that as well. Start there. 1, 5, and go up. So if someone, let's say at 5, has pain, and then part 2, lift your legs up. Good. Not that far. Good. And now I go back and repeat that with his legs off the floor. And if he says the pain is gone, that's a positive prone instability test. He had pain with his feet on the floor, but when he lifts up his feet, what that does is contracts his paraspinals. So it gives him stability at that segment. Pain goes away. That tells me that he's got something going on that's related not to hypo, but hypermobility. And I'm not going to push extension on this person if they have that combination. So it's a combination of two things. Pain with the feet on the floor, no pain with the feet off the floor. And it's in that little book by Tim Flynn. I'll bring it, you don't have it with you, do you? I'll bring in the numbers on sensitivity and specificity. I think they're pretty good. All right? But if that's negative, then he's got pain and extension. I'm going to go with the McKenzie model that there's some stiffness that we need to push on. And then we're going to talk about peripheralization and centralization. If at any time the pain gets worse or it gets very intense, it goes up to not just a 5 or a 6, but goes up to a 9 or a 10, we're going to stop.